Good morning everyone. I am Dr. Sai Karthik and my guide is Dr. Raman. I will be presenting about surgical outcomes of muscle transplantation surgery in management of childhood esotropia. Childhood competent esotropias are common forms of squint in children. Large angle deviation may necessarily require supramaximal recession surgeries. The possibility of odd disfigurement should be considered while doing these surgeries, like limited abduction, excessive adduction, narrowing of palpebral fissure, and ophthalmos should be considered. So, the goal of muscle transplantation surgery is it serves as an exceptional procedure to achieve competence through a single eye surgery. Here, we cut the we isolate the medial rectus and then we isolate the lateral rectus. Then the lateral rectus is resected. The resected part of the lateral rectus is being transferred to the recessing muscle. So after that, the recessing this acts as a recessing effect would be increased. So my study is to report the surgical outcomes in case series of childhood esophagus with clinical pressures undergoing muscle transplantation surgery. It is a prospective interventional case series where pediatric cases presenting with 75 to 90 preserved diopters of esodiviation is considered. Comprehensive ophthalmic examination was done along with orthoptic examinations such as motor tests, HCRT, cover, uncover test, alternate prism bar cover test, sensory examinations such as visual acuity, Snellen chart, cycloplegic refraction was also seen. And then the patients were followed up for 1 day, 1 month, 6 months and 1 year. These were the inclusion and exclusion criteria. This is a study of 18 cases where males were 6 and females were 12, and these are the age distribution, and this is the etiology, various etiologies that we have found. This is the first case where a 5-year-old girl vision was normal, and she had a 90 prism diopters of esodiviation along with the inferior oblique overaction. Now it was diagnosed as alternate esotropia with V pattern. She took up multiple transplantation surgery along with IO graded recession and right eye IO recession. You can see the stable outcomes of this patient. This is a 7-year-old girl where the left eye vision was not improving more than 624. In PDR values, you can see that there was high spherical power. So we diagnosed this patient as left eye strabismic anisometropic amblyopia. 70 prism diopters of esodiviation was there along with inferior oblique overaction. We took up for muscle transplantation surgery. It was corrected nicely. So the next, the amblyopia therapy was started to this patient. This is a 12-year-old boy. He had acute symptoms of double vision along with esotropia. Vision was normal. Compensatory head pester was there, and Wurzford test unclosed diplopia. So investigation MRI was within normal limits. So we concluded the patient has acute onset, acquired competent esotropia. We also took this patient for the muscle transplantation, where you can see very good result, and surprisingly diplopia also decreased after the surgery. So this is the last patient where she had 75 preserved diopters of esodiviation along with abduction limitation, suggestive of right eye strabismus fixus. So we took up for the muscle transplantation surgery. There was significant overcorrection of 25 prism diopters. So redo surgery was done. 5.5 mm LR recession was done to this patient. So 17 in this 18 cases, 17 cases we achieved orthotropia. One case we landed up with the exodeviation, overcorrection. All these cases have completed follow-up of 1 year with the stable results, and less than 6 years age patients were 22%, and 6 to 10 years age was also 20. The goal of these patients was not only to correct orthotropia but also to achieve binocular single vision. So far for our knowledge, no paper has been published showing the results of muscle transplantation surgery in childhood esotropia. We successfully collected large angle esotropia resulted from acute onset competent esotropia in 12-year-old boy and achieved the BSc. So Jatani et al., Dr. Jatani et al. In their study have showed the true muscle transplantation in adult patients. But in our study, we performed in the pediatric age group with the successful outcomes. So true muscle transplantation surgery is proven to be effective in treating large angle esotropias along with the oblique dysfunctions in pediatric age group. These are my references. Thank you.
Thank you, Dr. Sai. I think muscle transplant, it's a very tricky surgery.
Yes, sir. Yes, ma'am.
It has not been attempted in kids. There's a reason for it.
Yes, ma'am.
And because you are creating incompetence in a competent strabismus. I have seen your post-ops. Mild limitation still exists, means even minus 0.5, and that too in adduction that you are creating, because you have done for ESOs. So you're doing a large MRI session, added to it you have the resected tissue. So in a pediatric patient where the visual function is developing, you wouldn't want the convergence to get affected. So any kind of a limitation, like even minus 0.5 that I've seen in your 3 months post-op that you have shown, 1 year I do not know. So even a minus 0.5 limitation could affect the convergence. But you are showing good binocularity, right?
Yeah, he had a good binocularity, ma'am. Yes, ma'am.
Yeah. And
It was
another
corrected.
very important thing, had you taken ethics for this?
Yes, ma'am. We have taken ethics from the
Please do
patients.
show that in your presentation.
Okay, ma'am.
Because any prospective study, ideally all studies, but prospective studies, especially when you are doing something like this in a pediatric patient, do show your ethical clearance.
Yes, ma'am. Yes, ma'am.
Okay. Thank you, Dr.
Thank
Sai.
you. Thank you.